All right, that looks like we're stabling off. So thank you so much, everyone, again, for joining us for our latest media briefing on important healthcare issues in the news. I'm Dr. Samantha Hill. I'm president of the Ontario Medical Association, cardiac surgeon downtown Toronto. We represent more than 43,000 doctors and medical students across the province. This week, we're here to discuss Ontario's current stay-at-home order and whether or not it's time to lift the emergency order and start returning life closer to normal. So let's start by taking stock of where we are. This is the third province-wide lockdown since the pandemic began. It was imposed on April 3rd in response to an alarming surge in case numbers, COVID-19 hospitalizations, and ICU admissions. This stay-at-home order came as modeling numbers were predicting a significant escalation of COVID-19 infections. The highly contagious variants of concern were spreading at a significant rate and making people, and in some cases younger people, sicker. The emergency order is scheduled to expire on May 20th, right around the corner. And the people of Ontario are naturally eager to see life get back to normal, or at least something closer to normal than it has been for a long time. Ontario's doctors are recommending that the government extend the lockdown, but ease restrictions on outdoor recreation where it is safe to do so. The province is not yet ready to lift the stay-at-home order, while about 2,000 people are testing positive for COVID-19 every day, and 1,800 people are so sick they need hospital care, with still nearly 800 of them in intensive care units. But while we are recommending an extension to the lockdown, doctors also feel we should reopen more outdoor recreational facilities, things like golf courses, basketball, tennis courts, to improve people's physical and mental health. Of course, as always, this needs to be done safely, with clear guidelines around when to wear masks and how many people can gather in order to avoid large COVID spreading events. The May 24th long weekend is a potential risk. We want the third wave to be the last wave. Extending the stay-at-home order significantly increases the likelihood that Ontarians can enjoy more freedom this summer and have a more normal fall. It will help ensure that the healthcare system has the capacity it needs to treat COVID and other patients and can start to address the backlog. To examine all of the most current issues, we brought together the scientific director of Ontario's COVID-19 Science Advisory Table, an expert on immunization and vaccine hesitancy, and a public health doctor. And together, we're going to explore what it will take to return to normal. What does a first vaccination mean, and what does it allow us to do? How can we all stay safe as the weather warms and we get outdoors? How do we mark the Victoria Day long weekend? What is and what isn't off the limits? And finally, what steps can we take together to ensure that we have a better summer and fall? So with that introduction, I'd like to introduce you to our three guests who will give us their perspectives on how to find the path out of lockdown and towards a more normal future. Dr. Peter Jüni, the Scientific Director of Ontario COVID-19 Science Advisory Table since July 2020. He's also the director of the Applied Health Research Center at St. Michael's Hospital and is a professor in the Department of Medicine and the Institute of Health Policy, Management and Evaluation at the University of Toronto. Dr. Vanita Dubé works as an Associate Medical Officer of Health for Toronto Public Health, specializing with the Vaccine Preventable Disease Program. She also works as an emergency medicine physician outside the GTA. She's a member of the National Advisory Committee on Immunization. Dr. Kumanan Wilson is a specialist in general internal medicine at the Ottawa Hospital, Chief Executive Officer of Can Immunize, and an innovation advisor for the academic health organization, Briere. Dr. Wilson's research focuses on digital health, immunization, pandemic preparedness, and public health policy, as well as innovation. His research on immunization has explored vaccine hesitancy and evaluation of vaccine safety using health services data. I'm going to turn the table over to Dr. Jüni. Can you please start by giving your perspective as a member of the COVID-19 Science Advisory Table on what we can all expect in the coming weeks?
Yes, thanks. So what is important to realize is that we're on the right track now, and this is a combination of two different aspects. It's the current restrictions plus the vaccine rollout, and it's right now not that easy to completely disentangle the relative contribution of the two. What will come now during the next few weeks will be decisions about stepwise reopenings. And what will be extremely important, and I know I sound like a broken record, but I keep saying it, that we make a clear-cut distinction between inside and outside spaces. Right now, it's clear, that we need to be extremely careful and stay with restrictions regarding inside spaces, but we should really look forward now into, opening up outside, because we know that outside spaces are considerably safer and can be kept safe. We currently believe that the difference between indoors and outdoors is a factor of 20, meaning outdoor spaces are roughly 20 times safer. This corresponds, to the effectiveness of one of the mRNA vaccines from Pfizer or Moderna in terms of effectiveness of outdoor spaces as compared with indoor spaces. The challenge will be that we keep outdoors really safe, meaning that we would need to make sure that people stay in smaller groups, that if they're not belonging to the same household, that they will keep 2 meters distance from each other, or if they can't do that, if they play beach volleyball, for example, that they wear a mask. But there's a possibility to do so. So when we look into what's coming, I would believe or hope that we keep indoor spaces restricted as it currently is. Schools will be a different story, and I'm sure that others will talk about that, and that we then just see really a consistent stepwise reopening of outdoor spaces relatively soon, doing that safely, and then wait what's happening. And if this all goes well, which is likely to be the case, then case numbers will continue to go down. People will be more at ease, and we can then discuss next steps when numbers are perhaps at 800 to 1,000 per day. We need to achieve a situation where the testing and tracing system is not overwhelmed anymore, and we first need to go there before we even start considering opening indoor spaces.
Thank you, Dr. Uni. Dr. Wilson, I'm going to turn over to you next. What role do vaccinations play in when we can reopen safely, but also smartly?
Thanks, Dr. Hill, and thanks to the OMA. But I'd also like to thank the Ontario public. I think this third lockdown was a tough one. I think I can speak for all of us, a bit of a punch in the gut. We thought we were out of this, and it was hard for a lot of people. It was hard for small businesses. It's been hard for parents. It's been hard for children. But we needed the public to do this. And as Dr. Uni said, we're starting to see the benefits of all of this. But we still have a bit of a ways to go to safely reopen. And to speak to your point, Dr. Hill, we want to do it right this time. We don't want to lapse back into another lockdown. And so what we need to do is a smart reopening. And Dr. Uni spoke about some of the science that's going to guide this. We're going to look at the case counts. We're going to look at the positivity rate. We're going to look at healthcare utilization numbers. But this time around, we have another weapon in our armament. We have immunization, and it will be different this time. I'd like to point to this graph because I think the public may not understand what a remarkable accomplishment has happened in immunization. In an unprecedented time period, using novel technologies in many instances, we've developed extremely effective vaccines. So in these two graphs for the mRNA vaccines, the diagonal lines are what happens when you're not vaccinated, and the lines at the bottom are what happens when you are vaccinated. We don't see graphs like this in medicine very often. 95% effectiveness is amazing. So we're very fortunate to have these vaccines, and they really are going to help us get through this. And when we talk about the benefits of the vaccine, I think there are two things we need to think about. One is they have a role in protecting against serious illness. And virtually all of the vaccines do that. They help protect against hospitalization and death. And that's important, obviously, from the perspective of the individual, but it also removes the strain on the healthcare system. But they also have a role in preventing infectivity and disease transmission. And this is a little less certain, though we're getting very positive data from real world experience. And what this suggests is that every individual who gets vaccinated slowly reduces what we call the effective reproductive number of the virus. So we're all sort of weapons in this war against the pandemic, and we're arming ourselves. And eventually we hope to reach a level of vaccination where it's very hard for the virus to find susceptible hosts. And you know, I think we will see, and we're going to start to see the real benefits of our vaccine program soon. But vaccines work best when they're combined with public health measures. So historically, when we get out of these pandemics, it is a combination of public health measures and vaccination. Public health measures go a long way to reducing the rampant spread of the virus. Vaccines then can be introduced to further reduce the spread, but also help prevent the virus reemergence. And when they're combined like this, they work very well. And I think we see this in the UK with how they have come out of their last wave so successfully. And even once these mass vaccination programs are in place, we still need to be vigilant. We need to be able to detect new cases, contact trace, track our vaccines. So what do we need for these vaccine programs to be successful? I think we're seeing an example of that. We need to have ongoing monitoring of safety and effectiveness. We need to be able to adapt our program based on information on duration of immunity, need for boosters, the safety profile. Happy to see the reorientation of the vaccine program in Ontario to hit hotspots. I think it's important. People have to receive their second dose, and that's going to be particularly important in Canada, where we've delayed our second dose. Even in the US, where they have the shorter interval, 10% of individuals are not returning for that second dose. And for these vaccines to really work, we need that individuals to complete their series. We need to have a focus again on epicenters. And I think it's really important for people to know which vaccine they receive, particularly as these programs start to adapt and change. This is a tough question. I know it's going to be coming, so I thought I'd head it off. What can we do after we are vaccinated? We're still waiting for guidance in Canada. The CDC has provided some guidance on for what you can do when fully vaccinated. The only thing I'm going to state here, I put the link, is fully vaccinated means 2 weeks after your second dose. So an individual is not protected immediately after receiving a vaccine. It takes about 2 weeks to get the antibody or the immune response up. And I think sometimes some of the data we're seeing seems that people may be relaxing their measures right away, and that does increase the risk of infection. We're not really sure what happens after one dose. We know there's less protection against infectiousness in particular, although there's decent protection against getting seriously ill. So even with the one dose many people in Ontario have received, they are protecting themselves from serious illness. And that's important. But you know, for now, we're going to have to assume that the risk of infectiousness is pretty high, and we still need to take the public health measures. The AstraZeneca question. So first of all, the UK experience suggests that the vaccine works very well at the population level. Their numbers have come down very quickly, and it looks like they're staying down. Unexpected adverse events are the nature of novel immunization programs. We can detect 1 in 10,000 risk in clinical trials, and rare events can escape detection, and we need good post-market surveillance, and that's what we're seeing here. This happened before in 1976 with the swine flu vaccine, and even with the H1N1 vaccine. So we need to continually look at the data, do risk benefits assessments, and I think clear communication that acknowledges that there's going to be ongoing uncertainty. But the best decision will be made given the data. And something I've advocated for over the years, we need vaccine injury compensation programs. And the Prime Minister announced one was coming in December, and it's definitely going to be needed as we see some of these events develop. And I just want to conclude by, it's great that we're being vaccinated, but we really need the world to be vaccinated to be truly protected. We need to prevent the spread of this virus globally. And once Ontario takes care of its own house, it needs to help with the rest of what's going on around the world.
Thank you, Dr. Wilson, and thank you for ending on that point. The pandemic has really shown us how small of a world we're all living in right now. And apart from being the right thing to do, it's also how we keep ourselves safe. So it's a very important point. I'm going to turn it over next to Dr. Dubé. Dr. Dubé, can you speak to what public health measures we need and we should continue so that we can actually end this third wave?
Yeah, thanks, Dr. Hill. You know, I think when we got into the third wave, we, had multiple types of COVID that was spreading, and now it seems to be predominantly the variants. And we know the variants spread more easily and can make you more sick. But there was a question of, well, how can we prevent the spread? And I think what we're seeing the effects of is that those public health measures still work against the variants. And so in particular, the stay-at-home order in Ontario has worked. We've gone up the curve and are coming down now. And we're seeing great improvements, but we're still not quite there yet. Our case rate, I can say for Toronto, where we are right now, is still higher than the peak that we had in wave 2. And so we're going to need to see those numbers come down. When they come down more, we're going to be in a better position to reopen and to reopen safely. And so I think, continuing the stay-at-home orders, continuing to go out for essential reasons, going outside for exercise activity, for mental health, and doing it safely, as Dr. Uni has suggested, will actually help us to be able to abide by those stay-at-home orders. But again, keeping non-essential places closed for a little while longer is going to help us. But that being said, I think we need to work on schools. Schools are essential places for kids to go. That is their essential work. And so we usually talk about schools being the last to close and the first to open. And so I think when we start talking about easing up on public health measures, that would be one sector, one place that I would like to see open first. But again, wearing a mask, when you're indoors, especially, and when you're outdoors, when you can't keep that physical distance, especially when you're with people or near people who are not part of your household, that does work, continues to work. Physical distancing continues to work, limiting your contacts. And that's one of the things that we've seen with this third wave and with the measures is the data that looks at mobility showed that our devices anyways are spending more time at home, which probably means we're spending more time at home. And there seems to be that critical point at which when devices stay home and we stay home, we can again reduce that spread quite significantly. And we talk about that the reproductive number as being able to signify those contacts as well. So limiting our close contacts with people we don't live with is something that we're going to have to do. And again, until we get the numbers down a little bit more. I think it's also important to talk about testing and testing as a public health measure, to be able to detect cases. All of the results for testing go on to determine if it's a variant. And I think keeping track of the variants we have and any new or emerging variants is also important. But I do want to give some hope. Like, it's not like we're going to be in this place forever. And we're actually starting to see some change in Ontario as it is. So you've seen that in the long-term care home sector, they now have new guidance. If people are fully vaccinated, caregivers can now do more with their loved ones, can hug them. And so I think we can expect that there will be loosening of these individual recommendations as well as we get to a better place. And hopefully that's going to come. Hopefully that's going to come sooner than we want. So in sum, I would say, let's keep doing what we're doing. Let's open slowly. Go outdoors and let's be safe about it. And let's watch the rest of the world, because I think, we can get our hope sometimes in some of the countries like the UK that have had a very good vaccination campaign, have had good public health measures in place. And now we can look at them and see that their restaurants are opening, people are out and about, and they've gotten there. And so to be reminded that we are on the right track.
Thank you so much for that, Dr. Dubé. I've been at a vaccine clinics a couple of times over the last few weeks. And the number of people, when you ask the question, do you have any symptoms of COVID, who've been, no, I've been like, I haven't had a cold in a year or 2 years, just goes to show how those public health measures protect us from a variety of airborne pathogens. And so really, we are getting so close, and places like Britain really do demonstrate to us that there is an end in sight. I'm going to turn back to Dr. Uni with the multi-million-dollar question. Dr. Uni, can we reopen outdoor activities? Can we celebrate Victoria Day safely?
Yes and yes. You know, we've always suggested that we really need to focus on having outdoor space available for people. I was joking, you know, we need a stay at home and outdoors order, not just a stay at home order. And this frequently, you know, gets sort of confused in people's minds. The point here really is, as I said in my opening remarks, outdoor activities are on average roughly 20 times safer than indoor activities. It may even be that they're even more safe. This doesn't mean that you can let safeguards slip, of course not. We have had situations, you know, where people met in a backyard in the open, and the entire group actually got infected, and the 3 out of 5 actually ended up being hospitalized. These sorts of things happen. So it means we can open outdoor space, and we just need to have clear messaging. The clear message is as simple as I, you know, kept repeating everywhere else. Keep 2 meters distance from people who are not part of your household. And if you can't keep 2 meters distance, if you, you know, are involved in beach volleyball or you name it, wear a mask. It's as simple as that. If we talk about safe Victoria Day, it's again the same story. Let's not force people inside and hide inside. Let's get them outside, and let's make sure that we really clearly communicate how you can, for instance, have a barbecue safely outside. You know, again, 2 families don't sit at the same table when they're having a barbecue. They don't share beer bottles. If they need to come closer than 2 meters, they need to wear masks, but it's absolutely okay to celebrate Victoria Day safely together. We need to be aware of, you know, we probably need to have an understanding about the maximum number of people. You don't want to have, you know, just big congregations outside. Otherwise, my colleagues from public health won't feel, you know, safe anymore, rightly so. So, you know, we probably need just an upper limit. It needs to be discussed. How would this be? 10 people, 15 people or so? The point is, meet outside and meet safe. So that's absolutely doable. If you want the proof of concept, you can go to my home country, Switzerland. They have as many variants of concern as we have. They have admittedly a really good paid sick leave system. People can really stay home, and they have something that we haven't yet, you know, even discussed here, which is making self-testing available to everybody, which could help too. But the point is, they have outdoor spaces open completely. This includes also patios, for example, but with restrictions on patios. So, you know, that we really just have individual tables 2.5 or 3 meters apart. And on a table, there's only, you know, people of the same household sitting, and their numbers actually go down together with really, you know, stringent measures for restrictions of indoor spaces. This can be made safe. It is safe if we do it the right way.
Thank you so much for that. And I think you made a really good point there. You know, 20 times safer is significantly safer, but there is no perfectly safe. Even if stuck in our own houses alone, you're not perfectly safe. And so it's all about making the best decisions that keep us all as safe as possible as we move forward.
I think that's really important. You know, this is about risk reduction, not risk elimination. We don't live in a black and white world. We actually just want to acknowledge that if this is indeed 20 times safer outside, and if we stick to certain rules, that we actually can also go back to being some sort of social animals that we actually are. This makes us human.
Thank you. Thank you, Drs. Wilson, Dubé, and Uni. We're now going to open up our Q&A session. Please put any questions that you have in the Q&A chat if you haven't done so already. We'll try to get all of the questions, but if we don't get to your questions due to time, the media team will certainly follow up with you. You can also email media@oma.org with additional requests for interviews from any of our panelists, and we will have a recording of the session available later this afternoon. I will turn it over to Ryan to moderate the Q&A session.
Thank you, Dr. Hill. I'm just going to start by reiterating that, yes, we do actually have a lot of questions today, so we're going to do our best to answer as many as we can before 2 p.m., but we'll follow up with the media right away on the others. So jumping right into the first question from Sharon Kirky at National Post, which is directed to both Dr. Uni and Dr. Wilson. The Prime Minister yesterday said that we can hope for a 1-dose summer and a 2-dose fall, but what's the path out? What does history tell us about how pandemics end, and how do you see COVID-19 ending? A 4th wave in the fall, boosters here on out? Will we ultimately have to live with some amount of COVID in the community and some degree of death? I'll start with Dr. Uni.
Okay, so this pandemic likely will end with becoming endemic. You know, we will not eradicate COVID-19, at least not probably for the next decade. Let's see how things are going. So what will be happening is that this thing, from my perspective, will become like, admittedly, very tedious influenza, a flu, more like. This also means that, you know, once we've been fully vaccinated, this won't be the last thing that we will have done, you know, against COVID-19. We will need to get booster shots, most likely. The way out of this, indeed, will be to achieve at a population level sufficient immunity. You realize I avoid the term herd immunity. This is a moving target, and we should not, you know, just create a mythical creature called herd immunity. We achieve it and all will be fine. But what we can achieve in any case is that the overwhelming majority of the population is being protected, actually, which doesn't only include, you know, the most vulnerable, but everybody. We see it now during the 3rd wave. Also younger people, you know, are being affected quite heavily. And if we have, you know, a really high proportion, and we're in a much better shape than the US, for example, with that, because of less skepticism regarding vaccines than what we see, for instance, in the south of the US. If we do that really well, there's a real way out. The point will be our summer will probably be relatively okay. You know, we remember the last summer. This summer could be similar once we're through with this 3rd wave that we're in right now. And then the acid test will come in probably October, when it's getting cold and we move inside again. Remember, this virus strives inside, not outside, and we just need to keep really being careful there. What will come to our help as well, and then I stop and hand over, is of course that we now have modern vaccines, plug and play vaccines, that have such a technological edge over everything that has been there before, that we will be able also to be nimble and adapt to new situations with new mutations.
I'll answer quickly. I sort of see 3 ways out of this. One is we could have hoped that this virus would mutate to something milder. That really didn't seem to happen, but it's still possible. The second is we could have a therapeutic intervention. Then it becomes a treatable condition and much more manageable at a population level. And there's still hope on the horizon for that. And the third is the immunization program. And it's great that we developed these vaccines, but they're going to have to be distributed globally, because while this virus is circulating in other populations, particularly if they're partially vaccinated, we may be pressuring the virus. And so I think, again, if we want to really get rid of this virus and try to get out of this, we're going to have successful global immunization programs, just like we did with smallpox and polio.
Thank you, Drs. Kumanen, Wilson, and Uni. The next question is also from Sharon Kirky at the National Post, and it's directed toward Dr. Dubé. Dr. Dubé, the Oxford Vaccine Group is set today to report preliminary data on the COM-COV trial testing mixing vaccine doses. What we'll get today is a frequency of reactions in different dosing schedules, Pfizer after AstraZeneca and vice versa. The results are under embargo, but how important will this preliminary reactogenicity data be? Or is immunogenicity really what we still need? How well the combination of vaccines produce immunity?
Yeah, so thank you for the question. So I think when we talk about vaccines, actually the top of mind question for most people is it safe and does it work? And so I think we have to be able to answer both of those questions. And so this first data that's coming out is going to help us answer, is it safe? Because it's going to say AstraZeneca first, Pfizer second, Pfizer first, AstraZeneca second, Pfizer, AstraZeneca, AstraZeneca. What are the rates of side effects and what are the common side effects? And so I think this is the first step. At least it will be able to tell us if we don't have the information for immunogenicity, we can at least say if you get a mixed schedule, it will be safe for you. And I think from an individual level, that's very important, as well as from a population level, because we've had to make decisions from a population level about vaccines based on safety as well. The immunogenicity data will be important as well too. It's not just immunogenicity either though, because we don't really have correlates of protection for, well, if your antibody level is here, that means that you are protected. And so some of it is going to have to bear out also in how many people who had the mixed schedule got COVID compared to those that didn't. And so that will be really important to give an informed decision on effectiveness. But at least starting with safety is a good next step.
May I chip in and just to make one more remark, which is really important. When we talk about the symptoms that people are developing, after AstraZeneca first and Pfizer seconds, for instance, keep in mind, these symptoms are because the immune system is reacting. So having more symptoms, for example, doesn't mean that the vaccine is unsafe. You basically may feel a bit like being hit by a bus, as it happens, during the second dose of a Pfizer vaccine, if you have had Pfizer first. And that's just part of the game. You should actually be pleased if you're being hit by a bus just for a moment, and if it just goes away again. The big question will be whether it will be, safe just after a few days, etc. So having just reactions early on could actually be a good sign. Don't get confused there.
Thank you, Doctors Uni and Dubé. Dr. Uni, if you could put your hand, perfect, thank you. The next question is from Ryan Dubé at the Independent Media. And so throughout the pandemic, Ontario doctors and public health officials have iterated the need to keep schools open, with some recently saying that schools will be reopened before anything else. This is in spite of plentiful evidence suggesting that schools are a primary vector of spread. If schools are too important to be closed, why is the cost-benefit analysis missing from other as? Dr. Dubé?
Sure, yeah, happy to start here. So yeah, thank you for the question. I think the one thing we have to ask is, are schools a primary mode for transmission for COVID? And I think what we've learned in this year of living with COVID and having schools open is that the cases that we see in schools are very much a reflection of the community. And as much as we can prevent transmission in the community, we can actually prevent cases from coming into the school that are positive or that could be contagious. We actually have found that the cases that occur in a school have less of an ability to spread within the school setting than compared to in a community setting, and especially compared to a household setting. And so it's those layers of public health measures that are in place in the school that help to keep that school environment safe, so that if someone is contagious, even though they don't know it, we know you can be contagious 2 days before you have symptoms, so that that virus doesn't spread. And so it's the cohorting of students, the screening, wearing masks, physical distancing as much as possible, limiting visitors in the school, limiting interactions between cohorts. All of those things have worked very well. I can say in particular in Toronto schools, because that is my jurisdiction, I can say that with confidence. And well, then your question might be, well, why did schools have to close? Well, when the community rates were so high, we were seeing that many more cases come into the school setting, and then that was becoming a lot. And so as now cases are on the decline rather than being on the rise, before we open other sectors like retail or restaurants or whatever, we can actually open schools. And actually the modeling shows that if other sectors are still closed and we start with opening schools first, we actually don't see a huge impact on ongoing spread, that schools can safely be reopened without causing a large burden on community transmission.
If I may chip in again, it is really important also what was mentioned. Schools can contribute considerably to the pandemic getting out of control if you don't take the measures that were mentioned by Dr. Dubé. That's really important. So a lot of the data we have that indicated that schools actually contributed came from the UK, where these measures or some of these measures were not consistently in place, including masking, for example. So it's important to distinguish between the situation in the UK, for example, poor cohorting, for all I know, no masking, etc. The point is you need to have good public health measures in place to be able to open schools safely. And that's actually what has happened surprisingly well in Ontario. And that's really good news.
If I could just add one more thing, is to say that we've all been significantly impacted by this pandemic, like every single person, but children especially have been very impacted. And I think the data that's coming out on mental health, especially mental health in children, and very bad outcomes, much higher rates, and recognizing that schools being open is one tool to help address that is another really important reason why we need to consider. Again, you talked about that balancing benefits and risks, and that's another really important reason to consider why schools should be one of the first to open.
Thank you. Moving on to another question from Ryan Duby at the Independent Media. Vaccine hesitancy has been shown to be an issue around the world. Why can't the province be consistent with their vaccine messaging? Additionally, why have no vaccination goals been set that when reached would trigger the rollback on restrictions, a practice that would reduce vaccine hesitancy? Dr. Wilson, do you want to weigh in on this one?
Sure. So, when we talk about vaccine hesitancy, there's sort of three reasons people don't get vaccinated. When it's concerns about safety, concerns about effectiveness, but one that's overlooked is logistics. We like to talk about the crazy anti-vax ideas out there, but one of the major reasons people don't get vaccinated is organizing their vaccine appointments and just remembering to get their second dose. And that's the low-hanging fruit here. So, we can try to combat the viral anti-vaccine memes, but there's a lot easier things we can do. And I think that's where we really need to focus our efforts, and we still have a bit of a ways to go there. At the same time, communication is important. And I think a key component of the communication is just acknowledging the uncertainty. I think the public's the adult public are adults, and they can handle that, and they understand the situation we're in, and I think they've handled it very well with the changing messages on AstraZeneca. But I think where we run into problems is when we're very definitive at one moment in time, and then suddenly something changes, and then we're very definitive the other way, another moment in time. And that's what gets the public frustrated. And I also think we need to understand that when people do express views that perhaps are somewhat discordant with ours on vaccines, that's understandable as well. This is a complicated, difficult situation, and people are allowed to have their concerns, and we need to take them seriously and respect them. That being said, I am really on Canada and Ontario, and everybody seems to be really supportive of vaccination here, and it is helping us. And I think we're in a better situation in the US in that respect. And then to the final question, vaccinations are one part of a combined initiative. It's not the vaccines alone that's going to get us out of this. It's vaccine and public health measures. And if we just look at the objective measures, that's the metrics we need to use to get out of this. And the vaccinations as they go up will result in those other measures coming down.
Thank you, Dr. Wilson. The next question is from Brian Lilly at the Toronto Sun. Prime Minister Trudeau said we are in for a one-dose summer. What does that mean to you? Summer is Ontario filled with festivals, concerts, sports, lots of mass gatherings. Are any of these possible in a one-dose summer. Dr. Uni, do you want to weigh in on that one?
Yes, I think the mass gatherings are a real issue. We need to be very careful if you have a one-dose summer. First of all, we need to see how we approach 1 versus 2 doses in our own province here in Ontario, obviously, So we now have a vaccine rollout that acknowledges that we have perhaps 70 to 100 neighborhoods that were disproportionately affected by this pandemic so far, and we now manage actually to increase faster the vaccination rates in these hotspots. And one of the questions will be whether these hotspots should experience a one-dose summer, or perhaps should we seal the deal and really get people fully vaccinated in regions like Peel relatively early on to keep not only Peel and challenging neighborhoods in other areas of the province safe, but also help to keep the entire province safe. So let's see how this goes with 1 versus 2 doses there. This will need to be an ongoing discussion. Now, if we talk about festivals, etc., again, one of the issues is we need to ask the questions together with our colleagues from public health, etc. Are there possibilities perhaps in July or August, once we see, that the case numbers have really gone down considerably, to have outdoor space used perhaps also for some sort of concerts, etc. The point would be we cannot deviate right now from physical distancing between households, as long as we don't have fully vaccinated people, and as long as we don't have case numbers really low. The risk is just too high, and the question will be, and we should have these discussions, are there ways also to have slightly larger events distributed, spread, and kept safe, so that, I don't know, a classical concert, for instance, could be made possible if it happens outdoors. I don't have an answer, and I might scare a few people off by even thinking aloud these sorts of things. But again, if we do any of that, it can only happen outdoors.
I just want to add that the one dose summer piece is, the whole point of delaying that second dose was solely based on supply. That's why the National Advisory Committee on Immunization made that recommendation. Our supply is improving, and if we reach a point, June, July, where our supply is abundant and we can shorten those intervals, that is certainly something that is a recommendation from the National Advisory Committee on Immunization. And so again, vaccine supply very much plays into whether it will be for everyone a one dose summer.
Thank you, Doctors Uni and Dubé. Next question from Holly Mackenzie-Sutter at the Canadian Press. In light of Ontario and Alberta halting first AstraZeneca doses, how can we best empower people to decide if they still want the second shot? Is there a risk of that halting first doses will give rise to more vaccine hesitancy in the general population? Dr. Wilson, do you want to weigh in on that one?
And again, you just have to ask for the patience of the public, and we're appreciative of the patience of the public on this. The data, more data will become available on all of this, and as was mentioned with the mix and match studies, can we get a good immunologic response with this different second vaccine that we may actually have more supply of? Some are arguing we may even have a better immune response. The good news we're sort of seeing with AstraZeneca after one dose is the immunity lasts for a while. And in fact, the timing of the second dose is 2 to 3 months later. So that's, people are protected by it. And so that's the good news. Now, what vaccine should you get for your second dose? Well, if the studies are available that suggest that an mRNA vaccine of the second dose is as good, if not maybe perhaps better, and that's what the supply is, I think that's where people would be directed. I think we also have to be aware that the beauty of these mRNA vaccines is they can update them for variants. So we may have an mRNA second dose later on that actually has protection against some of the variants that the current vaccines don't cover.
If I may add something, I think what we've seen during the last 10 days, even though after NAS's press conference, there was a public outcry about inconsistent messaging, and even though I agree that the communication was not optimal, what you've seen is actually that the system works. NAS, as an independent body, came up first with a message, which was actually, not the ideal and most convenient message for our prime minister on a federal level, for example. They came out with the message anyway, and it shows you NAS's primary concern, as many other people's, is really the safety of the public. And what you now see also the reaction of the province now, it's the absolutely right direction. So I would hope that people see that this actually should boost confidence and not the opposite. There's nobody out there who actually wants to just hide behind the paternalistic view of, okay, we decide what the people needs to know. The people need to know what the situation is, but the people will also need to understand that science is emerging and that we move very fast. And what we try to do is we just try to do, try to achieve as much transparency as we can. And yes, sometimes the messaging wasn't optimal, but I think the message is now out there that people also can decide for themselves.
Thank you, Drs. Wilson and Uni. The next question is from Maris Habibinia. There's a lot of misinformation about the connection between COVID vaccines and birth control pills causing unwanted side effects. Can you clear this up? Dr. Hill, do you want to weigh in on this one?
So I have to admit, you're catching me a bit off guard because I haven't heard any of those rumors. But what I would say is what I've heard is people saying that the frequency of side effect is very similar between the two, and the frequency of clot is very similar between the two. I will defer, though, to any of the physicians on the line who can comment more specifically on what rumors are now circulating.
Well, if I may weigh in, please don't compound any of this. This was one of the things that really gave me goosebumps when I saw well-meant infographics that start to talk about blood clots after the birth control pill as compared to the VITs, actually, that we're talking about here. This is a completely different animal. It's also the case that if you are unlucky and experience one of these immune-caused thrombosis called VIT, or abbreviated with VIT, then this is a really serious clinical situation, which is much more serious than a clot in the veins of your legs, etc. So if you want to have the right analogy, then you would need to talk about people having experienced a major stroke, or dying. That's basically the extent of complication that we're talking about, that we are concerned about when we talk about VIT. It's rare. 1 in 50,000 means, driving from Toronto to Ottawa, return 20 times. Then you have the same risk of dying in a fatal car crash, more or less. That gives you the right order of magnitude, and is comparable with, the frequency of VIT. But if you actually just are unlucky and experience this, then this is much more severe than a conventional blood clot. And that's important to realize, so this should not be compounded.
Thank you. The next question is from Ryan Dubé again, and it's in follow-up to Dr. Dubé's opening remarks. The theme here seems to be that public health measures that are successful at reducing spread. However, there's plentiful evidence that schools are a major vector of transmission. If there is serious concern about the spread of COVID, why are schools last to close and first to open? If they are deemed too essential, where is that risk-benefit analysis with regards to other public spaces?
Okay, I think we sort of answered this earlier, but to kind of reiterate, to say that schools are not the primary place where COVID is spreading and then circulating back into the community. The direction seems to be the other way. And just to add a bit more to the way I answered earlier, is to say, since most schools in Toronto reopened this year, after the break in February, there was a lot more asymptomatic testing being done, for example. And so thousands of people around Ontario, students, staff in schools were being tested. And the positivity rate from all of that asymptomatic testing, I don't think it ever went above 1%, was always lower than 1%. And so this is kind of people who choose to get tested because they want to make sure that they're not positive. We also do a lot of testing, though, in a school setting. So if someone in a classroom, in a cohort is positive, we then send the whole cohort home. Actually, we ask the principal to do that so that we risk any additional spread. And then we ask the cohort to be tested. And that's how we can detect additional cases and prevent additional spread. And you don't actually find routinely that we've actually never found that the whole class turns positive. If you find additional cases, sometimes those students get it in school, in which case we declare an outbreak, but sometimes we're detecting cases, and when we do the investigation, we find that they actually got it from a household. And so I think in the Ontario setting, at least in the Toronto setting, where I can speak from my own data from our public health unit, that the transmission within the school setting is actually lower, especially because of all of the layers that we have in place, including things like enhanced testing that we've had added more recently. I think as well as we look into the future, vaccines will be one additional tool for the classroom, especially as we think longer term. And so that's another measure that will be considered as well.
Thank you, Dr. Dubé. Next question is from Andre Vuk. When will we see a reopening of the economy in Ontario? When can we see a fully reopened economy like we are currently seeing in the United States and many other countries? For example, music festivals, bars, amusement parks, sports games. Dr. Uni, do you want to weigh in on this one?
Yeah, it's difficult to tell. To be honest with you. So it depends on what it is. Again, having restaurants open outdoors, patios will be much earlier. Music festivals outdoors will be much earlier. The acid test really will be, September and October when we start to move in. And that will be a challenge. What we need to achieve is high complete vaccination, hopefully by September. And this will be tremendously helpful. But we need to move just very carefully, especially if we talk about, indoor spaces, increasing capacity indoors. There we just need to be careful. And if we, would achieve, which I would hope for, an 80% complete vaccination rate in Ontario, this would be really, really the move into the right direction that would allow us to open more. I'm evading the question. I can't possibly give you an answer. If you talk about the US, you need to be aware of that, first of all, the US have had really high infection rates. Once they receive a first dose of vaccines, many people will have full protection already. The places like Florida still have high case counts right now. And they're also right now in a situation where Florida is basically just, honeymoon in terms of having everything in terms of activity just happening outside. So things, will change then too. We need to achieve just a higher vaccination rate, complete vaccination rate, to be in the same shoes as Florida. And remember, Florida's rates of cases right now daily and ours are actually nearly comparable again.
I'd just like to add, in a point of optimism that, obviously we want to get our case counts down, but if we find the vaccines are protecting against serious illness, hospitalizations, and people are getting infected, and enough people have the vaccines that even if they do get infected, they don't get seriously ill, that could help us reopen. And so that's, again, speaks to the importance of even a one dose of a vaccine can do that, can help protect you from getting seriously ill.
What we know, perhaps the last point, which is important, is that one of the measures that is particularly effective is restrictions of indoor gatherings to certain sizes. So this is important, large gatherings indoors will come relatively late when we're really safe and have seen that all the stepwise reopenings worked well without surges. And we need just to take that easy. If we just have 50 people indoors, then somewhere in the autumn or so, When do we move from 50 to 100? This needs to be handled very carefully, step by step.
I'm going to add to that, Ryan, if I can. Apologies. There's a bit of a false dichotomy that we keep coming back to about health versus economy, cases versus economy. And it's not accurate. It's not true. Nothing obliterates an economy faster than a pandemic. Having hundreds of thousands of people sick at home closes businesses. Having hundreds of thousands of people dying closes businesses. And so it's not a question of one or the other. It's a question of us getting both things done in a way that is safe and moves us forward incrementally, so we can stop moving a couple of steps forward and then 5 or 6 steps back. We want to be moving forward incrementally in stable motions so that both the economy and the public health can continue to improve and we can wind up back on the right track like other countries have done.
Thank you. Now we're going to go on to the last question from Joanne at the Hamilton Spectator. Hamilton is having an issue with outbreaks in apartment buildings. We now have 3 and one has more than 100 cases. What can be done to prevent this? What advice do you have for the residents? Dr. Dubé, do you want to weigh in on this one?
Yeah, so I think when we hear about outbreaks in apartment buildings, we get worried. Does that mean that it's spreading through the ducts and someone who's living on top of me or beside me, that's how they're getting COVID? And I think we have to realize that COVID can spread in apartment buildings because people live in apartment buildings and socialize with other people in apartment buildings. And so I think this is what we need to actually really be able to tease out. What is the risk in the apartment building? I think a lot of situations show that people are congregating, they're getting together. It's again an indoor space, and that's how it may be spreading. Again, that person-to-person spread, which is the way that we've seen COVID spread. Now, we do know that COVID can spread through aerosols, but again, we haven't seen documentation yet of COVID being spread through aerosols going through a HVAC system into someone else's apartment. That's not currently the data that we have. And so I think when we look about apartment buildings, we have to make sure that we have measures in place in the apartment buildings, that we have masking requirements in place in common areas, that we limit who comes into our home to just those who are in our household, that we don't leave our apartment if we have symptoms, for example, but we can also improve our own ventilation. Can the windows be opened, for example? Is there a good, proper functioning HVAC system? I think those are questions that we need to ask people who manage the apartment buildings that can be really important as well.
Thank you, Dr. Dubé.
Just to, just so that Dr. Juni doesn't have to say it again, if we can make it easier for people to associate outside and they aren't feeling like they have to hide inside to do this, I think that could go a long way to reducing these outbreaks.
Just to give you an example, recently somebody described that to me, a fire alarm in an apartment building, vast majority of people in this apartment building were elderly, and they went down, because of the fire alarm. Guess what? They assembled in the lobby, not outside. Completely wrong. That's the sort of thing that happens then. They assemble inside with masks, etc., but they still just congregate inside rather than going outside, even though the weather was okay, it wasn't rainy. So that's the sort of things that we need to avoid. Inside space right now is just a no-go. We just have too much going on there. The daily case numbers are just too high.
Thank you. So this concludes our Q&A portion of today's briefing. We do have, unfortunately, a few questions that we couldn't answer, and our media team will send responses, but please, if you would like an interview, please email us at media@oma.org. I'm going to turn it over to Dr. Hill to provide concluding remarks. Thank you.
Thank you, Ryan, for excellent job mediating and moderating the session. Thank you, everyone else, for attending today's briefing and for your very thoughtful questions. There are still so many questions about the pandemic and about COVID that are being answered on a daily basis that I hope sessions like today are helpful in helping you to inform your reporting. I look forward, as always, to watching and reading your coverage. And again, if there's a topic you'd like to hear us discuss, please send along your suggestions to media@oma.org. In the meantime, thank you everyone again for your time. Get your vaccine, stay safe, and stay healthy.